Hello, my name is Jaidyn Christophe, and the health campaign that I will be presenting today is Combating Hypertension in the African American Community. There are a few steps in the health campaign process. The first step is defining the situation and potential benefits. Step 2 is analyzing and segmenting the audience. Step 3 is establishing campaign goals and objectives. Step 4 is selecting channels of communication. Step 5 is designing campaign messages. Step 6 is piloting and implementing the campaign. And Step 7 is evaluating and maintaining the campaign. In Step 1, which is defining the situation and potential benefits, we will discuss African Americans are affected by hypertension at a much higher rate than any other community in the United States. According to the Centers for Disease Control and Prevention, the overall prevalence of high blood pressure is 54% among non-Hispanic Black adults as compared to non-Hispanic white adults with 46%. The potential benefits of this campaign are, by combating hypertension, we can lower the rate at which African Americans are dying of complications from hypertension and help the African American community to live a longer and better quality of life. Step 2 is analyzing and segmenting the audience. The audience that we are trying to reach through this campaign are lower income members of the African American community that are more susceptible to suffering from hypertension and educating them on prevention, risk, and treatment. Step 3 is establishing campaign goals and objectives. The goal of this campaign is to inform lower income members of the African American community of the risk and potential dangers of hypertension. We hope that if African Americans are educated on the effects of hypertension, that if they are provided with resources in order to manage their blood pressure, then we will be able to decrease the amount of African Americans suffering from hypertension. The next step is Step 4, which is selecting channels of communication. By selecting channels of communication, this will help us to accomplish our established campaign goals and objectives. We intend to spread this message through social media platforms. We want to post facts, tips, and resources to help the African American community to close the gap on the disparity they face with hypertension. We also want to spread the word through physical marketing campaigns such as signage, pamphlets, and other physical copies of our information that can be posted in doctors' offices, schools, and churches in the local communities. In Step 5, our goal is to design campaign messages. Our campaign message and slogan will be Drop the Number, a fight against hypertension. The number refers to the amount of African Americans suffering with high blood pressure and dropping the numbers we read to tell blood pressure. Blood pressure is categorized by two numbers, an upper number and a lower number. A normal blood pressure is considered less than 120 on the top and less than 80 on the bottom. An elevated blood pressure is considered between 120 and 129 on the top and less than 80 on the bottom. A high blood pressure, which is hypertension in stage 1, is considered between 130 and 139 on the upper number, or 80 to 89 for the lower number. High blood pressure hypertension stage 2 is considered 140 or higher for your upper number, or 90 or higher for your lower number. Now, hypertensive crisis, which would cause you to want to consult your doctor immediately, is when your blood pressure number on the top is higher than 180 and or your lower number is higher than 120. Our goal is to educate the African American community to the best of our ability so that we can have as many normal blood pressures as possible, rather than getting to the hypertensive crisis stage, which many African Americans unfortunately do see that stage, and it becomes more of a problem than just having high blood pressure. The next step of our campaign would be step 6. Step 6 is piloting and implementing the campaign. The first area that we want to release this campaign in is a predominantly African American neighborhood such as 3rd Ward, Houston, or Pittsburgh, Southwest Atlanta. Neighborhoods like these need to be educated on issues such as hypertension because not only do residents suffer greatly, but we hope to be able to provide resources they need to improve the rates at which they are affected. Step 7 is evaluating and maintaining the campaign. Now, this can be considered the hardest part of your health campaign. We intend on maintaining this campaign by expanding into other neighborhoods after seeing the response we get in the first areas and continuously improving the way we run our campaign. We will always ask for feedback and look into new ways to make the campaign accessible and more helpful to participants. Finally, here are our references. Thank you for listening to our health campaign proposal. Hopefully, we can change our community day by day.